Hi there, this is Bella Vasto with Bella's House and Pet Sitting here with Dr. Josh from North Scottsdale Animal Hospital. I've got a situation that I would love to understand. I was actually chatting with my friend who's the manager over at Applewood Pet Resort, and she had noticed that a dog's stomach flipped. That kind of scared me thinking about it as a pet sitter. She said they had like very limited time to get it to the emergency vet, or else the dog could die. So as a pet sitter, I'm thinking, and also a dog owner, if I were ever to walk into a house, how would I know if a pet's stomach flipped or if they had bloat, and what would we do about it?
Well, the condition you're talking about is commonly referred to as bloat. We refer to it in veterinary medicine as a GDV. And basically what happens is the stomach, in usually large breed dogs, fills up with a lot of air and begins to twist on itself. And when it twists, it cuts off blood supply, which, as you can imagine, is a very serious condition. Now, if you or one of your pet sitters walks into the house, the first thing they might see is many spots where the dog has attempted to vomit. And you may actually see the dog actively trying to retch or vomit but not producing anything. The other thing you could do is actually, if you lean your ear into the dog's side or abdomen and just flick, tap, you might actually hear a sound as if you were tapping a basketball, that pinging sound. If you didn't already see that the dog's belly was significantly distended. Oftentimes these dogs are really lethargic, they don't want to move, they don't want to get up. If you notice any of those symptoms, you really want to contact the veterinarian ASAP because time is of the essence if we're going to save these dogs' lives.
That's incredible and incredibly scary. Is that, I seem to remember Marley and Me. Do you remember that movie? Is that what Marley had a lot?
Well,
I think he was eating so fast that it bloated.
Yeah, one of the things that sometimes we look for or we hear about before dogs bloat is the fact that they consume a lot of water, they eat very quickly, and perhaps they even go out and run around and play. So that is a risk factor. Some people also feel that the way dogs eat, from an elevated feeder, perhaps eating food off the ground, is also a risk factor. We don't completely understand the condition, so one of the things we really try to do is educate owners when they're getting a new puppy or a young dog who is a large, deep-chested breed. In fact, some of the things that we sometimes advise people to consider doing is actually suturing the stomach to the body wall to prevent it from twisting. It can still fill up with air, but the really critical thing is if it twists on itself. So by doing the surgery, especially at an early age, we can reduce the likelihood that'll ever happen.
That is incredible. I hope you've all learned a lot. I have. I'm going to remember flicking the stomach and a basketball sound, and then, of course, calling your personal cell phone number. This is Bella Vasta with Bella's House and Pet Sitting with Dr. Josh for North Scottsdale Animal Hospital.